We're using the Hive. It's part of our overall activity in this space. So what we're really keen to do is to make sure that we can engage with colleagues, we can engage with staff, we can engage with external parties, and then collectively we can use that to identify where some of our major challenges are, areas where we can have the most impact, where we can make the most change, all aligned to our organisational priorities. So what we want to do is to use this space as an informal area where we can bring people together, we can exchange ideas, we can use them on focused activities and see if we can come up with some initial potential ways forward and solutions going forward. And so we were very fortunate that we were talking to some colleagues within Welsh Government who very generously were able to provide us some initial funding to equip, to cover some of the more technical aspects and technical equipment for the area. And then the Health Board Health Charity very generously contributed both to the hire of the current marquee where we're situated, as well as some of the other furnishings. And then we also had some very positive support from our executive team as well. And so we're very lucky that multiple parties came together to create this space.
I think the Hive offers a great opportunity for staff to come along and just kind of decompress, because it's just so busy out there. It's just so pressurized at the moment. Staff are working so hard, and it's just nice to be able to have a space that when you walk into, it feels really chilled, it feels really relaxed, it feels really warm and welcoming, to have the different seating as it's arranged, to have the sofa area with some books that you can actually, do a kind of library exchange. It just makes it feel like that social environment, and it's got that vibe. So I think it's really important that we keep this space, because we can see the benefits, we can feel the benefits when we walk in, and we need to spread this to other sites as well.
So the Hive Camerado space here is very much a space where staff can come along in a comfortable, warm, safe environment, have a sense of belonging, be alongside other people, have a chat, have a cup of tea, have a game of Connect 4, argue over what your favourite biscuit is. But it's really just a space which you can come during any time of the day, any time where you are, regardless of what's going on, and have conversations with people or not, regardless of where you are at, without feeling as though someone's going to fix you, without an agenda, just a place to come and be alongside someone, whether you know them or not, during your day. And it's a space where you can find that.
I like it because it's a space inside the hospital, but it's not to do with the hospital. So it gets you out of thinking about work, really. It's a space just to come and just chill out from the day or from your break and your lunch.
So the idea for the Hive came from a number of different places. I'm the Innovation Manager for the Health Board now, but I was a nurse previously and worked all through the pandemic on the front line. So there was a real sense within me that the Health Board needed somewhere for the staff to hang out that felt less clinical, felt more comfortable. So the Camerados part of the Hive definitely came from that, came from a view of wanting people to be able to look after each other, wanted to pick people up, share the problems, and just, look after, without healing people, just look after each other. And then the collaboration part of the Hive came from a wider remit with support from Welsh Government to find a space that was central in the hospital, that people can come together, can work together. There's a lot of siloed working across the hospital, just because people do work within their space and their environments, but it does mean that we repeat work. So it's important to try and have a central space that people can access easily, where they can come together, share ideas, share their learning, share their research, and we can all learn as a bigger team. It's also a space where we can bring external companies in that connects them with the hospital. There's something different about meeting those organisations and businesses in external buildings, because they don't get a real sense of the problem or what we're actually about. So for me, it's important that it's very central, it's easy to access, and it's a bookable space, so all of our staff can use that to meet their colleagues.